So the condition that I researched on was Down syndrome. So what is Down syndrome? Down syndrome is a condition that occurs when the child is born with an extra copy of chromosome 21. There are three types of Down syndrome. It can be called trisomy 21, full trisomy 21. That's what you typically think of when you think of Down syndrome. There's translocation Down syndrome or trisomy 21 and mosaic Down syndrome or trisomy 21. Individuals with Down syndrome may have developmental and intellectual challenges, and individuals with Down syndrome typically have characteristics that are present at birth that get more distinct as they continue to grow. So, some common physical characteristics include a flattened face and flattened right at the bridge of the nose, right through here. Almond shaped eyes that slant, and they typically also turn upwards. A protruding tongue, so they have a smaller mouth, and their tongue tends to stick out with their mouth when they try to close their mouth. A short neck, small ears, hands, and feet, low muscle tone, loose joints, and a short height. And I also included this little picture that explained some things that I also didn't mention. So, white spots on the colored part of their eyes, the single palmar crease, and short fingers, and they typically curve inward. And then their feet, they typically have a wide separation between the big toe and the rest of their toes. And they usually have separated joints between the bones of the skull. So it's even like it's always important for proper head protection with babies and infants, but especially with those with Down syndrome, you have to really be protective of their skull. So some common comorbidities with this population that are important to be aware of is congenital heart defects. So like heart murmurs, there's other heart defects. I didn't research all the heart defects. It was just general heart defects that it mentioned. It was just like heart murmurs are very common. And there's other ones. It's just different depending on the child and what they have. Hearing loss is important to be aware of. So if the teacher's saying that the child's not listening to rules, not listening to the peers, is it that they're not listening, or is it that they have a hearing loss or they're having hearing difficulty? So maybe being aware of that, or if the child does have known hearing loss, are they using hearing aids? Are there any other assistive devices or tools being used in the classroom? Are they using sign language? Things like that. Obstructed sleep apnea. Sleep is an occupation that OTs address now. So I feel like communicating with the parents, with the teachers, because we will be working in a daycare where there is nap time going on. So talking with the teachers and the parents, understanding how sleep is going with the child, and if that is an area of concern, because sleep apnea can also create low quality sleep. So seeing if there's any ways that OT can help address sleep concerns. Visual impairments, so being aware if the teacher or the parents or through observation if the child is experiencing difficulty seeing material, using any of the material in the classrooms. Do they wear glasses? If so, how are they wearing them? Are they able to keep them on throughout the day? Just being cautious and aware of that. Hypothyroidism is another one. Blood disorders and low muscle tone and joint conditions. So some common facts, or some facts that I saw. Down syndrome is the most commonly occurring chromosomal condition, with approximately 1 in 700 children being born with Down syndrome in the United States. Life expectancy of individuals with Down syndrome have increased in recent years, being 25 years in 1983 to currently 60 years and older due to improvements in medical care, which I thought that was just an amazing fact that I saw, because it's kind of crazy to think that people with this condition typically only live to be 25 years old, not that long ago. Like that was not that long ago. And now it's up to 60 and older. So hopefully as medical care continues to improve, so will the life expectancy for these individuals. And women who become pregnant at an older age have an increased risk of having a child with Down syndrome, having a 1 in 350 chance at the age of 35 and a 1 in 30 chance by the age of 45. So between 35 and 45, that tends to be the highest chance I mean, typically women aren't having children past 45. They can, some can, but when you get to the 35 to 45 range, that's when these women start having the highest chance of having a child with Down syndrome. So full trisomy 21 and translocation trisomy 21. So full trisomy 21 is the most common form of Down syndrome, accounting for 95% of diagnosis. So this happens when the individual inherits 3 copies of chromosome 21 instead of the typical 2. And this means that they are inheriting 3 full copies. That's why it's also known as full trisomy 21. Translocation trisomy 21 accounts for 4% of Down syndrome diagnoses, and this is when there is a partial third copy of chromosome 21. So this could be that they have a half copy, a half third copy, or they have 3/4 of that third copy. Whatever it is, they do not have the entire third copy like full trisomy 21, like the most common form. But full trisomy 21 and translocation trisomy 21 have very similar physical characteristics. So when you are working with children who have both of these, or either one of these, I should say, you're not going to look at them, notice their physical characteristics, and be able to determine, oh, you have translocation trisomy 21 or you have full trisomy 21. They're very similar, and it's very difficult to do that based just on physical characteristics. You typically only know if it's full trisomy or translocation by a blood test confirming. So mosaic trisomy 21 is the most rare form of Down syndrome, accounting for 1% of all diagnoses. Mosaic trisomy 21 happens when only some cells in the body inherit the third copy of chromosome 21. This results in a mixture of typical and atypical cells in the body. So going back to full and translocation trisomy 21, they have all the cells in their body have that third copy. Even the translocation, even the partial third copy, every cell has that makeup. But for mosaic, only half or only a third or only a quarter of the body has that atypical cell. So this one's a little bit harder to know based on physical characteristics if the child does have Down syndrome, only because not every cell is presenting with that third chromosome in the body. So individuals with mosaic trisomy 21, they could have low muscle tone, unstable joints, but they have no physical characteristics with the eyes, their tongue, the small ears, things of that nature, or they could. It really just depends the makeup of their body and the genetics. So with this one, it might be a little bit more difficult to work with a child and say, oh, they have Down syndrome. Most of the time, this one, a lot of families notice like developmental delays or intellectual concerns, and then maybe some physical attributes, and then they go to and bring that up to their doctor, and then a doctor performs a blood test. I have heard of mosaic trisomy 21 and worked with some kiddos with this. So it is at first, you're kind of, for me anyway, at first I was kind of like, there's no way, like this child doesn't have, but a blood test does confirm that they do. And then you kind of start noticing more, like when you're working with them, like, oh, yeah, they do present with a low muscle tone. They do have the unstable joints. Okay, maybe they are presenting with some visual impairments and some intellectual concerns. So the more you work with them, the more you'll understand what's happening with them personally, because it could be different based on each child with the mosaic trisomy 21. And then some common OT assessments with this condition include the Peabody Motor Developmental Scales, so the PDMS-3, which is birth to 5 years and 11 months old. So this is a perfect age range that we are working with to be using this, because we are working with the Scholar House kids that are 0 to 5 years old. And then the BOT2 is ages 4 to 21. This is also a great motor deficiency assessment. There are 2 classrooms at the Scholar House that are ages 3 to 5. So working with that classroom and working with the 4 to 5 year olds, you could use the BOT2. And then sensory processing measures. So children with Down syndrome do tend to have a lot of sensory processing concerns, or like specific like sensory processing concerns. So the sensory processing measure has preschool ages 2 to 5 years old, and that's also a great age range for the Scholar House to use this. as well as a sensory profile, which is birth to 14 years. And because the sensory profile has an infant, a toddler, and a child one, and this one you just give it to the parents, they fill it out, and then you score it, and then you have a meeting with whoever's involved on the team and discuss the results. So some tips with working when working with a child who has Down syndrome. So breaking things down into smaller steps, completing tasks in 1 to 2 steps at a time. So trying not to give them too many steps, which in general might be a good rule of thumb for any child that you're working with, especially 0 to 5. You're not going to list off 10 steps and expect them to remember it. Because I mean, they're kids. So, and then be patient and give them time to complete tasks and what was asked of them. Remember joint protection for this population, especially when you're doing some gross motor tasks. Be cautious if they fall, wanting to check those joints, making sure that they're all good. And then working with arm strength and weight bearing, especially through those hands. Achievement of motor milestones, so rolling, sitting, positional changes in the use of their arms and legs. And this can also go back to addressing primitive reflexes and integrating those. And then for sure, sensory. And here's some more continuing on. So, addressing oral motor concerns impacting feeding, since a lot of them do have that smaller mouth and a protruding tongue. If you're working with babies who have Down syndrome, it might be harder for them to latch when feeding, or if they're already like done with the bottle using baby food, like eating with a spoon, it might be harder for them to do that, especially, or even if they're in the older classrooms and they're old enough to be feeding themselves, doing that. Getting the food in their mouth, swallowing the food, working on those, addressing that. Positioning and feeding techniques for a child and the parent, that goes back to the latching. Physical motor skills, including gross fine motor skills, facilitation of self-care skills. So for this age range, I know a lot of the teacher or all the teachers at the Scholar House really work on hand washing with the kids, helping them as they get older recognize, oh, you have a dirty face. Does your face feel dirty? Let's clean your face. Or wipe your nose. A lot of them have like dirty noses throughout the day, like getting them to try to recognize those self-care needs. Like, oh, you have a dirty nose. Let's wipe your nose. Oh, you have a dirty face. Let's wash your face. Let's wash your hands. And also toileting is a big thing. Like a lot of kiddos are potty training. So helping them with potty training tasks would also be a great idea. And a lot of kiddos I know that I work with, they have difficulty not wanting to touch messy things. So helping them, maybe that's another sensory thing. So playing with doing messy play with the kids to help them understand, like, oh yeah, when my hands get messy, I can wash them off. And that can also correlate back to potty training and being able to appropriately like wipe and clean themselves after toileting. Fine motor skills, social and emotional needs, or emotional needs and self-regulation needs, because a lot of children with Down syndrome will have difficulty being able to regulate themselves, especially once they become emotional, and getting themselves back to their regulated self could be a difficulty. And then finger dexterity and grasp patterns. And these are my references.